From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the people who make it happen. I'm Erin Treloar. If you're anything like me, you've probably seen blepharoplasty all over your social feeds lately. Eyelid surgery has become a go-to for anyone looking to refresh and brighten their look. But have you heard of winged blepharoplasty? If not, you're in luck, as we're joined by Dr. Prem Tripathy, a double board-certified facial plastic and reconstructive surgeon at Bay Hills Plastic Surgery, who specializes in the winged blepharoplasty procedure. Dr. Tripathy will walk us through the surgery, who it's right for, and how it helps patients feel brighter, more balanced, and confident. Hello, everyone. I am so thrilled to be sitting down today with Dr. Prem Tripathy to talk all about winged blepharoplasty.
Thank you so much for having me. Excited.
I'm so curious, when you were in your medical journey, at what point were you like, plastics is the direction that I want to go? Was there an aha moment, or was it more of an unfolding to come into the place that you are today?
Yeah, I think it was definitely an unfolding. I mean, working with plastics patients, you realize it's a totally different set of patients. They're coming in because they want something, not necessarily because they need it. They want to look as good as they feel, move into the next decade of their life with that. And so those are the patients that I just gravitated towards. Those were my people. I definitely loved like the surgical, oncology, all the other facets of my specialty. But this is where I really found my passion. There wasn't like an aha moment as much as just I felt like these were my people.
We're going to talk about eyelid surgery, also known as blepharoplasty today, and your specialty, winged blepharoplasty.
Yeah.
So first of all, what is blepharoplasty?
Yeah, so blepharoplasty is just a broad term for eyelid surgery. That can be upper eyelid surgery or lower eyelid surgery. Winged blepharoplasty, I talk a little bit more about that for the upper eyelids, but really it's just any surgery on that. It could be skin removal, fat removal, contouring, just shaping that area. But it's, the first thing people look at when they look at you is your eyes. And it's the first thing people start to notice that changes with time. Yeah.
And why is it that we start to notice changes in the eye area first?
Yeah, the eyelids are the thinnest skin on the face. And so those are just more subject to UV damage, gravity changes, laxity, collagen degradation. These are just much more common in that area. So that's why I tell people the best eye cream is a sunscreen, because it's the thing that's going to protect your eyes the most. And then genetically, hooding or double or heavy eyelids, it's just really common in, as you get older in life, or just genetically. And so because that skin is thin, you're going to see it first.
Who would you say is generally coming into your clinic to talk to you about this? Is it people who are getting older, or are you seeing it with a wide variety of ages at this point?
Yeah, it used to be that it was much more patients in their like 50s and 60s, sort of like realizing that they couldn't put their makeup on or they were looking different in pictures. And now with social media, I think patients are realizing that they're still bothered by these things, and that the fix is not necessarily something that's age related. They want to look their absolute best, which means that sometimes they want that crease to show a bit more. They want their makeup to go on better. So I think now people understand more about blepharoplasty, what's entailed in that surgery. And it's not as scary as people thought. So I am seeing a shift towards the younger demographic for sure.
Okay.
Yeah.
And those people who come in, you mentioned that they're sometimes have hooded eyelids or drooping of eyelids.
Yeah.
Anything else that they're concerned about or complaining about?
Yeah. When they talk about drooping, it's usually like the lateral portion. So the edge sort of near the outside. And because winged eyeliner, that's why I call it a winged blepharoplasty, that winged eyeliner is harder to put on. That's a really common thing that I see. And then patients sometimes say, like, I look different in pictures. When I smile in pictures, that skin is starting to hit my lash line. I don't like the way that looks, or I feel like my eyes are looking tired. That's a very, very common. Or like I don't feel tired. I feel good. I just look tired. The other part that people may not notice, but they're bothered by, is that there's fat in the corners near their eye. So in the corner here, that they notice that fat is starting to come forward. That makes people look tired too, but also maybe on the older side than what they really are. And so they just feel like the contour is very irregular, and that's what they're complaining about.
Can you tell us a little bit about the actual procedure and
Yeah.
what's the difference between a regular bleph and a winged bleph?
Sure. Yeah. So I sort of came up with the like concept of the wing blepharoplasty when I was realizing that the way that I was taught how to do blepharoplasty was to make the lateral edge wider so that the skin is taken more on that edge. And what that does is it creates a really nice crease in the middle, but not on either edge. And so while it looks nice partially, it's not necessarily addressing what patients are concerned about. So the way that I contour and mark those areas out is I really try to wing the lateral edge of that area so patients can put their makeup on, their eyes look brighter. And I think one of the reasons why people don't do that is they're worried about the scar. The scar heals super well as long as it's closed properly and patients take care of it. It heals very, very well. But the way the procedure works is fairly straightforward. You come into the office. If you want to take a medication, we have those for you. But otherwise, it's done under local anesthesia. So we just mark the area up. That's usually what takes the longest is the marking. Inject some local anesthesia in there. Your eyes are closed. We talk throughout the whole time. You can talk or you can fall asleep.
Wow.
It takes maybe 30 minutes. You can drive yourself there and back if you don't take the medications. It's relatively straightforward. Yeah.
Wow.
So, I mean, it's an easy surgery from the surgical standpoint. It's obviously a big commitment on the patient standpoint. I don't like poo-poo that part of it. But with respect to all comers, it's a fairly straightforward process.
Wow.
Yeah.
One thing I was really interested about is the process. I watched a couple of videos before speaking to you, and I was surprised to learn that you're not actually doing much with the muscle underneath. So I figured that it was probably any incision that was being made was going quite deep. And you realize that you're really just dealing with the skin on the eyelid.
Yeah. So for the vast majority of patients, if they have excess skin, that's all we're taking.
Yeah.
Going into the fat areas, we will contour or mobilize fat either to fill hollows in or to remove some fat. That process takes, a little bit longer, but that takes your blepharoplasty result to the next level.
Gotcha.
But you're right. I mean, for the vast majority of patients, if they have a little excess skin, you're taking that skin out, suturing them back up. You're trying to hide the scar in the natural crease. You're trying to close it without any tension. These are all small things that will affect the ultimate outcome. But yeah, it's relatively straightforward.
Is there anybody who would not be a good candidate for this type of surgery?
Yeah, I would say people that have heavy brows where it seems like the eyelid is more, the heaviness is contribution from the skin and the brow. Those are patients that may not be a good candidate just for a blepharoplasty alone. And then any patients that have something called ptosis, where it looks like one eyelid is kind of lower than the other, they may require both ptosis correction and blepharoplasty because, believe it or not, the input to the eye is symmetric from the brain. So if you take some skin out of one eye, you could actually unmask a ptosis on the other eyelid. So if you don't see those things and you don't pick them up, then patients might think that their eyelids are droopy, but it's really just that their eyelid is heavy and they have ptosis. So those patients may require additional procedures. And then patients that already have a very well-defined crease, there's really nothing to take. So I do have patients that come in and they say, I want a blepharoplasty, my eyelids feel heavy, and there's nothing to take there. So there's no ethical way, there's no good reason to do this kind of procedure and trade a scar for really no reason. So those patients, I think we start to notice things that sometimes don't exist. And so in that case, there's just no need to do it.
Right.
Yeah.
It's just not going to be the right candidate.
Yeah, exactly.
If somebody wanted to do this, but they actually like their eyes or like the shape of their eyes, is blepharoplasty and winged blepharoplasty going to change the shape of your eyes?
It's a good question. It's probably the most common one I get.
Is it?
It shouldn't change the shape of your eyes. So the shape of your eye is partially determined by where the attachments are medially, so at the center and laterally. And that's just with genetically the shape of your lids. And because you're taking skin above the eyelid, it shouldn't change the shape of your eye. I say shouldn't because if you end up with ptosis after surgery, which is a potential rare but significant complication, then that could change the shape of it. Or if you have other adjunct procedures that could minimally change the position of your eyelid also. But generally for upper blepharoplasty, you should not be having a change in your eyelid shape.
Okay, amazing.
Which is nice.
I want to talk a little bit about the healing process, how long that takes, and how we reduce the scar. You have mentioned the word ptosis, though, a couple of times. And I can imagine somebody who has one eyelid that's drooping more than another might be considering an upper bleph.
Yeah.
And so can you just break down what ptosis is in case
Yes.
maybe people aren't even aware that that's what they have?
Yeah, so ptosis is where one of the eyelids compared to the other, you can have ptosis bilaterally,
Yeah.
but generally it's noticed when one eyelid is sitting closer to the pupil than the other side. So if you were to, get out a ruler and measure the distance from the pupil to the lash line, one side would be a shorter distance than the other.
Okay.
So some people call it a lazy eye, or they may have seen that complication with Botox where they end up with a little ptosis. And in that case, I have patients that come in and say, hey, I have a droopy eyelid. Their crease actually is different on that side as well as a compensatory mechanism. So patients might think that really it's just eyelid skin, and it takes kind of pointing that out to them to help them realize it's not eyelid skin, it's the muscle, and that muscle can be damaged, in a way that we don't know what happened to it. It could be trauma related, it could be neurologic. Sometimes it's just ptosis that we don't know what causes it.
Okay.
And so for those patients, it's also a ptosis correction thing.
Okay.
Yeah.
So if you are somebody who's relating to what he's saying right now and you go in to see a doctor, make sure you check in with them and have them assess whether or not you have ptosis.
Yes, most definitely.
Let's talk about the healing process. What does that look like?
So the healing process is actually maybe a little more surprising than people think. As easy as the procedure is, you drive yourself home and back, because the eyes are so vascular, there can be a significant amount of bruising. So I'm very transparent with patients. If you don't care whether you're bruised when you go out in public, there's really no downtime, right? Stitches are in for about 5 days. Those come out at 5 days, then you could put your makeup on. I have my patients put makeup on after 5 days.
Okay.
But that bruising, it'll start in the upper eyelids. You look like you have like pink eyeliner, but then it'll drain into the lower eyelids. So you could end up with looking like you have 2 black eyes from the surgery. And it takes maybe 7 to 10 days before the bruising is gone. And then you're back to normal activities.
Wow.
Still no heavy lifting for about 2 weeks. And then you're taking care of your scar. You're using scar gel and sunscreen, which I usually provide to all my patients, which most doctors do. And you're just kind of taking care of that incision. But the thing that I always tell patients so they don't freak out is that week 3-ish, your scar will change. It's going to go from not visible to a little thicker, and then it will soften with time. So as it gets ropey, don't freak out. It's part of the process. Trust the process.
All right.
But it will take some time to kind of relax.
If somebody tends to have keloids when they have a
Yes.
scar, is that likely to happen with an upper bleph?
Good question. It's very, very uncommon. So keloids are genetic, but they're also dependent on how the skin is closed. And it's more of a hypertrophic scar, like a thick scar.
Yeah.
So you can end up with those on the face, but the eyelid skin is so thin that I have pretty much never seen a keloid on an upper eyelid. I've seen some thicker scars that we can treat, but even that's fairly rare. Because it's such thin skin, counterintuitively, thinner skin actually heals better and heals faster. So my patients that are 70 that are doing upper blephs, their skin heals so quickly, and you can't see the scar a lot faster than my younger patients. Yeah.
What are your thoughts on doing it almost in a preventative way? Like for somebody who's my age, I just turned 40, in your 40s or 50s versus waiting until you're 70 and you're going to have a lot more heaviness and drooping. Any thoughts on that healing in those different decades?
Yeah, I do think there's a place for some preventative treatments. Like I do think like toxin, lasers, skincare, sunscreen. These are nice preventative treatments. They help you move into the next decade of your life looking and feeling your best.
Yes.
Surgery, though, I think is a little different. If there's, at least my philosophy, if there's something that does not bother you at this point in time, whether it be in pictures or in front of people or in the mirror, and nothing's changed, I'm not in the surgical preventative camp. There are other things like Botox that can subtly help the eyelid shape, but if it's not bothering you now, it's probably not worth cutting out.
Love that. I really appreciate that perspective. I have some Ask Me Anything questions from our audience. Everyone's very curious about this. So the first one is, I'm 50, and lately I've noticed that my eyelids seem a bit heavier. It's not drastic, but I feel like my eyes used to appear more open and my eyeshadow would show better. Would you recommend a winged blepharoplasty or a traditional one in my case?
Yeah, I always recommend a winged blepharoplasty because I think it creates the most space between the lash and the crease and still looks natural. You'll be able to put your makeup on, but it's really important to also assess the brow. We don't talk about the brow enough, but it's always something we look at when patients come in, because if the brow is also contributing to that heaviness, then you might also need, or it's recommended that you get a brow lift at the same time. But if there's enough space there and the makeup is the issue and you feel like you look different, then a blepharoplasty is definitely the way to go.
Okay, amazing. Can a winged blepharoplasty help reduce the appearance of dark circles under my eyes?
Good question. A winged blepharoplasty, in my opinion, is really just for that upper eyelid to create more space laterally.
Yeah.
Lower eyelid blepharoplasty is more complex of a surgery. It involves moving fat around, taking skin out, transposing fat, doing fat transfers. Those are primarily the things that improve dark circles.
All right, our next question. Can I still wear contact lenses after getting this procedure?
Yeah, so contact lenses, as long as you feel comfortable, you can definitely put your contact lenses back in. That's usually just pulling your lower eyelid down and putting the contact lens in.
Right.
If you do manipulate your upper eyelid to put contact lenses in, I recommend just waiting a few more days.
Yeah.
But you should be very comfortable putting them back in right after surgery, or even that day, even the next day.
Amazing.
Yeah.
All right, and my last question. Are there non-surgical options like fillers or Botox that can let me try out the winged eyelid surgery or shape before committing to the actual surgery?
Yeah, I do like non-surgical treatments as like a test drive. Unfortunately, I don't think there's a great one for upper eyelid bluffs because you have excess skin that's sort
Right.
of getting down to that crease. There's nothing to remove that. Botox can give you a subtle brow lift. So sometimes that can make extra space.
Yes.
So it might be enough for you. You might think, oh, this is actually fine. It'll last a few months and I'm okay with that. And there are some fillers that you can put under the brow to give you a brow lift also.
Okay.
But in terms of removing skin, tightening that area, there's just not a good one. Even lasers, in my opinion, don't do a great job of giving you a good test drive.
I feel like I've seen individuals have Botox kind of in this area. I'm
Yeah.
just pointing above my eyebrows,
Yeah.
kind of laterally. Can that create that lift that people are looking for? Like it's not removing skin, but
Right.
might create a bit of a lift.
Yeah, so if you're Botoxing the muscle that pulls your brows down,
Yeah.
you're basically weakening that and you're allowing only the muscle that pulls your brow up to work. So it's a tug of war between those two muscles.
Oh, interesting.
So if you have a strong muscle pulling your brows up, you'll get a nice result out of it.
Yes.
But if you don't, then you may not see much of a difference.
I see.
And the only downside is brow lift Botox usually doesn't last very long because we can't fully paralyze that muscle. So it will give you an idea of what your brow lift could look like. And
Gotcha.
it will make makeup go on a little easier. But it's not going to give you an idea of what skin removal will be, unfortunately.
Gotcha.
Yeah.
Amazing. I feel like I've learned so much in
Nice.
this episode. Are there any final things that you would like somebody to know who's considering having winged blepharoplasty?
Yeah, I would say definitely go in to an expert for your consultation and discuss what your concerns are and have that full discussion about what it means to you and why you're bothered by something. Because I always ask patients, does it bother you that you have excess skin? Does it bug you in pictures? And if
Right.
it's minimal, then I would say maybe you're not ready.
Yeah.
But if it's something that's been on your mind and you just want to kind of move into the next phase of your life, get all that information, have them assess your brow and your ptosis, but just go to an expert. That's the way to go.
Okay. Amazing. Thank you so much for joining us today.
Thank you guys for having me.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.